We're going to do a little kyphoplasty, vertebroplasty, cement augmentation. And what's cool is we're using all 4 different companies. So Tyler, go ahead and come to a lateral, and we're going to show you guys what we're doing here. So the first level that we're going to do, we're doing a sacroplasty, and we have excellent assistants here. We have Sven Friel from Bochum, Germany, and Dr. Ravi Nuna, one of our spine fellows here at Swedish. And this is like a potpourri of companies. So the first level, if you guys can see the blue cannulas here, this is a company that's called Define. And Tyler is doing some excellent fluoro shots here. You can see we've already put these cannulas into the sacrum. And now what we're going to do is, Josh, let's see the osteotome. So all these companies, so the main, so there's two cement augmentation procedures. The first one was actually developed in the 80s and actually was one of the professors of radiology at University of Virginia. His name was David Kalmes. And what they did is they put PMMA into the sacrum, and because there's so much cancellous bone in there, that the cement goes right into the bone and is able to immediately fixate the spine. And for compression fractures, the key is to be able to get as much cement in there without having it leak. So there's a certain amount of viscosity, and most of the companies have all now created, they all have their own instruments, and this is a very nice instrument made by Define. And I don't know if you can see this. Let me pull it back a little bit, but it's got a little curved osteotome. Sorry, let me put that back in here. I'll just put it in the center of the field so you guys can see it. Just focus on the tip, Lee. Maybe what I'll do, let me just move it to where all the cannulas are so you don't have to move it around. There we go. So can you guys see this? And see how it curves? So as I turn the instrument here, it starts to curve. Can everybody see that? So we're going to put this into, and then it straightens out and it can go the other way. So we're going to straighten it out, and then Ravi's going to put it into the S1 cannula. And what this does is because of our, it's got mostly cancellous bone, but there's some cortical bone in there. So let's get a shot there. And so now what we're going to do is push it in a little bit more, and then I'm going to just tap it and have it go in. And then what we're going to do is we're going to turn the osteotome, and it'll create a cavity. So the cavity creation can be done by a balloon, it can be done by osteotome, it can be done with an implant. You can see how anterior we are. So we're going to pull it back just a tiny bit. And then what we're going to do is we're going to turn this clockwise, shot there. And this is going to create, can you guys see that? The osteotome's creating a little cavity for us. And then Sven, you do the same thing on your side. And then we're going to be ready to inject cement. So you can see how quick this is and how safe it is. And again, depending on the cement that you use and the viscosity, obviously, one of the things that can happen is it can leak. So we want to minimize leakage. We want to maximize the amount of bone that the cement goes into. And I think we're so fast, Josh is still mixing. So what we'll do, while that's mixing, again, this happens in real life, we're going to go to the next level. So we have our colleagues from Stryker. So we have Regan here, and this is very cool. So this is a totally different cavity creation system, and you can see it's a little titanium implant. It's basically like a stackable, expandable cage. But it's an implant. It goes in like this, and then it'll open up the vertebral body as we put it in. So we're going to actually go ahead and do that. So these are the little inserts, and so we're going to put it in, and then they just go straight in like this, And then let's take out our osteotomes so let's turn it. So we've already created a cavity, so we're going to go ahead and take out our osteotomes. We don't need those anymore. And then we're going to turn it this way. And did everyone see that? So now we did S1, now we're doing L5. And you can see, can everyone see that? So that's a pretty good, you want to go kind of mid-vertebral body. And now we're going to start turning it clockwise, both sides. So Sven is going to start first. These aren't as, you don't have to do as much as you did last time. I know last time Puria had a hard time turning the knobs. He's actually taking a break right now. He's so tired from the last. So let's get a shot there. And he's going to keep turning it, and then it's going to open up without, hold on to there, and then shot there. So keep going. So, great. And we've already drilled this. We drilled it before, so there's a little drill that we used. Okay. So you can get one more shot there. Okay, so now you can start to see it open up. Can you guys see that? And then now, great. So keep going. Yep. And then now we're going to do my side. And then once it kind of just bottoms out. It'll lock out once. Okay, good. You can see it there. Can you guys see that? Okay, so now Sven is almost done. So Sven, take a feel. It'll just pop. So that's good. So it's almost bottomed out there. So now, Ravi, you go ahead, shot there. So can everyone see that? Okay, now Ravi's going to go ahead and do it. So hold on to that. And this is called the spine jack. So hold on to there and then turn it. And then our defined, let me know, Josh, when the cement's ready. A couple minutes. And then, Regan, you got yours. And then we also have our Medtronic colleagues and also our DePuy cement. So can you guys see that? So now Ravi's got his spine jack. Yep. And then what we'll do is, so can we, Regan, so now both of them have been fully deployed, and then we're going to be ready. Are you guys ready? Yeah, it's ready. Okay, so let's go ahead and, so can everyone see this? So this is the cement. And it's got a little cannula in it, and you can see the cement starting to come out on my finger. And it's starting to, okay, so now we're going to go ahead and put this in there. Okay, let's get a shot there. Okay, good. So, and then you can turn the wheel to lock that in place. And then let's go ahead and start. Shot there. So let's go ahead and pull it back a little bit. Oops, let me see. Shot there. Okay, go ahead and start deploying the cement. And again, you can see under visualization, you can actually see the cement going in very nicely. Keep going. Yep, keep going. And this is kind of a hydraulic system, and you can see accurately measure. And Ravi, keep going. Okay. So, and then we're going to put a little bit more in. Shot there. Sometimes it's hard to see in the cadaver, but you can start to see the cement go in. Okay, now let's put it on the other side. Shot there. Okay, so maybe pull back okay, keep going. Turn it. You can start to see the sacral, just the tip of the sacrum. Can you guys see that? That's a beautiful. And then I'm just slowly pulling the cannula back, and I'm going to get the rest of this. I want you to see how nicely you can it'll just spread. Go a little bit more, Ravi. Okay. And then now when we want to stop, what we'll do is we'll squeeze it, and then now go ahead and, Sven, go ahead and take that out. No, just undo the dial. Okay. And then we'll do the same thing we're going to do Ravi's level. So let's go and get a shot there. Okay, now, so let's do this one. And then Regan, we've already deployed the spine jack, so do we need to disconnect it?
Back it off a half a turn.
Okay.
The butterfly handle.
Okay.
Back them both off.
Okay.
And then just this pin, turn it a bunch of times until it loosens up.
Okay, cool.
That out.
Great. And then, so we're ready for cement as well. Does it just come out? Okay, cool.
Now you have your
Great. So the spine jack has been deployed,
Yeah, I think we're almost done.
and then shot there. Great. Keep going. And then keep going, Sven. And then pull your. Just pull the whole thing out. Okay, good. And then.
Yeah, so just take it out.
Okay, let's get one more shot. Okay, good. And then I'm just gonna go ahead and, now we'll go ahead and take this out. And then what I want you to do is just give it a little bit more. I'm just gonna pull it back a little bit. Okay, shot there. I wanna try to get the back wall. Whoops, shot there. Go a little bit more. Okay, great. So now go ahead and stop it. And then I'm gonna pull it out. Okay, so now let's go ahead and get the Stryker cement. Okay, and then, so you guys can see this is a different system now. And then I'm gonna put it in, and then we just twist this, and the cement, and it puts pressure on, and it comes out this way. So let's go ahead and put that in there, great. And then, so now, let's see how strong Sven is. Okay, so let's see, so you guys can see. So let's get a shot there. Great, keep going. And then they're all kind of radio opaque. Shot there. Okay. Regan, how far down is that?
That's it.
This is max out there. Okay, shot there. Okay. And you can see actually this is good. You can see a little bit of cement going into the disc space, so stop. So go ahead, shoot that. So you can see it's going a little bit north. Now, one of the big concerns with this, now does he have to turn it back when I pull it out?
No.
Okay, is that, obviously you can get into the, putting in the vertebral body, it's like putting it in the largest vein in the body, so you can get a little bit of leakage, and you can get some hemodynamic vascular changes. Oftentimes, you get a little bit of hypotension, shot there. And again, you can kind of see that there. It's filling the L5 vertebral body nicely. And how many cc's was in there?
Put in about 4 cc's, 200.
Yeah, so that's about the right amount. So we've got 2 on each side. And you can see actually, this is typically, the other one leaked. I think we fractured the end plate. And it leaked through the end plate, went in the disc space. And then this one is staying right in where that spine jack is. Go one more turn. So, okay, great. So now we're going to go ahead and take that out. And then is there like a little tamp? So these all have a little tamp in. We'll just tamp any of the cement. And you can actually feel it. So watch, shot there. It's going to go in a little bit. You can see how it just kind of pushed some of that cement in. Okay, shot there. Okay, good. Yep. And then what we'll do is, that's actually nice. Yep, we'll pull, yep. And then we're gonna pull out the previous cannulas as well. So we've done, in the span of just 5 or 6 minutes, we've done 2 levels. And again, we used, so for the spine jack, this opened the vertebral body up. We drilled the pedicles, and then with the define, we used an osteotome. So this is what created, because you have to create a cavity. This created the cavity. And then now we're going to pull out the rest of that. Let's get a shot there. So that looks nice. Now we're going to go ahead and we're going to use so now we're going to go to the Medtronic system. So let's go ahead and let's go ahead and then you can see here, Medtronic has a very nice drill here. So Ravi's going to go ahead and drill his out. And then let's get a lateral there. That's perfect. So
you go deeper. Or?
Okay, and then shot there. Okay, and then now you go ahead and drill yours. Let's see where that shot there. Okay, good. So that's fine. And then let's go ahead and get a quick AP again. And you can see how we really have to, with Tyler Laws is doing a great job, but you can see our trajectories, and the floor really is essential here. So, great. So let's go back to the other view. So now we're ready. And again, the Medtronic system is a little different. They have these balloons. And then we're going to put these in. And then once the balloons go in, they kind of inflate. We can actually even show you guys. Can you guys see that? So go ahead and hold on to that. And then it starts to fill up with, can you see that? So, and then you have to be careful because you can't pop it. So this PSI goes up to about 200, I think. Before it starts to really inflate. But yeah, the bottom number says you can go up to 700. Is that what you would?
Yes.
Okay. Okay. So that you can see that. And then, so let's go ahead and put that in on your side, Ravi, and then we'll do the same thing on, deflate that completely. And then we'll do the same thing on your side. And then once we create the cavity, then what we'll do is we'll put, okay, shot there. Shot there again. Hold on 1 second, shot there. Yeah, so shot there. Go ahead and start ballooning yours. Okay, shot again. Okay. Yeah. So actually, this happens in real life. Sven went past 700 psi, so it popped. That's okay. So that's fine. Shot there again. So that's okay. We do have. So now let's go ahead and. How far are you? Go ahead and keep going.
It's not going up at all.
Oh, it's not going up. Okay. And again, this is actually,
Oh, there we go.
this happens in real life. They pop. Sometimes they don't inflate, but no worries because we've got our cannula. Okay, that's fine. Shot there? Okay. So let's go ahead and deflate the whole thing and then pull it out. And same with you. Pull it back more. Okay, good. Okay. So now... Okay, so now we're going to go ahead. We have our fabulous Kyphon cement, and then we're going to go ahead and put that in, and then it's almost like a trigger, and then we'll lock it in place. Great, and then let's get a shot there. Okay, terrific. So go ahead and just keep pumping, and then you can actually see, so there's is there about 8 cc's in here? Yep. Shot there? Great. So you can start to see it's... Okay. So shot there again. So we created the cavity. Keep going. And then we're going to do the same thing. Great, and then stop there. Okay, that's pretty good. So now we'll stop there and then hit that button, and then now we're gonna go to your side and then give the gun to Sven. Okay, no, so now Sven, you take the gun and then you go ahead and put that, it's got a little, there we go. Okay, shot there. Good. So let's try to put, and then now we're going to move towards we have our Depew colleagues with the Confidence Cement. And again, they have the same kind of platform. And we're going to put this in. Okay. Okay. And then do you have, let's see, is your cement ready to go? Okay, great. And it just goes in, right, Brian? Okay, so let's get a shot there. Terrific. So you can see how much of the vertebral body. So now we'll do the next level. So in our institute, we actually have a phenomenal physician. His name is Dr. Glenn David, who does all these. So he's really terrific, and most of the techniques that I'm doing here. Now, Brian, how far down does this need to go? Should I go all the way down?
Yeah, you can go all the way.
Okay.
And then when you rotate it back to 5 millimeters, it deploys the...
Oh, it does. Okay, shot there. Oh yeah, so you can see there. Can we see it? And do you have one? Great. So let's go ahead. Let's do the same thing on this side. So this has also a little cavity creation device in it. Shot there. So can you guys see that? So we're going to put that in there and then do the same thing. So turn it this way, counterclockwise. Can you see that, Robbie? Mm-hmm. So shot there again. So.
No.
Okay, and then now we've got both sides shot there. Okay, that one went a little bit kind of far, but that's okay. Shot there. That one's Sven, shot there. Okay, good. Shot there. Okay, great. So now we're ready for our cement. What's the name of this thing again, Brian? Oh, okay, that's not very ingenious. It's called a cavity creator. Okay, so can you guys see that? So this is the cavity creator. And essentially what we did is we put this in and then it kind of deploys itself. Can you see the angle on there? So you can kind of see it right there. Okay, so now we're ready for our cement. Did you see how it just kind of deployed? Mm-hmm. And again, usually when I put cement in, it's with fenestrated screws. If not, I have my colleague, Dr. Glenn David, do it. In fact, he's going to show you how to really do it nicely. He's going to do it in the thoracic spine. We're doing it in the lumbar spine right now. And for tumor cases, typically what I like to do is, if we're doing, for example, a construct, the chance of having an adjacent level of fracture is pretty high. So I'll do the reconstruction, and then the next day or sometimes during the same anesthetic, Dr. David will come in and do the augmentation above and below. The incidence of having a fracture afterwards is pretty high, and it's just so much easier to deal with it early. And if you know they're at high risk, then we typically will do it while they're here, all in one setting. And then again, all the companies have all great systems. In fact, Define's got a radiofrequency ablation system too, where you can actually burn the end of the, instead of, you can see right here, it's got a little coil, and the coil heats up and it burns the tissue. In fact, we can show you guys, and the system is warming up right now. Is it good to go? Okay. So we'll show you, we got a little banana. We're gonna, so Josh was kind enough to fly up here from Los Angeles. So we're gonna go ahead and we stuck it in a banana, and then, yeah, we won't be able to see it, but you guys can see the machine. He's heating it up. That's actually a nice banana. Do you have an extra one? Okay, good. So you can see the distal end of it is about 25 degrees, and it'll start to burn. And actually, I've seen Dr. David use this quite a bit. So if you've got a couple metastatic lesions that are above, that are in the bone, you can put the radiofrequency ablation in, create a cavity, burn the tumor, and put some cement in all at once. And we've done that a lot. Glenn and I have done that.
It goes up to 50.
Wow. Okay, great. So that's what that looks like. And then now we're ready with the cement. This cement is called Confidence. So unlike the cavity creation device, this has a little hydraulic system. And basically, you just put it in. And it's actually the same system they use for their screw system, which I use. Shot there. And let's go ahead and start. And it's really nice because you can actually, whoops, I fell out. We didn't tighten that all the way in. But you can really direct how much goes in. You can precisely put in exactly how much you need. Okay, let's get a shot there. This thing came loose. Do you have another one, Brian? Oh, I got it. Okay, that's fine. Go ahead and. Some of the cement got in the. Okay, that should be okay. All right. Okay, go ahead and start. Okay, hold on 1 second. Shot there?
I think it's leaking.
Yeah. Brian, we got a little bit of cement in the, so it's coming off the needle. Let me get another needle. But you can see in here, basically, and then pull it back some. So when you pull it back, it'll actually, let's see if we can get this one on there. Some of the cement got in the, let's see if we can get it to go all the way on. Okay. Do you have another one, Brian? That's okay. Well, that's the, huh? That's all right. Well, we're good. Okay, I'll just hold on to it and try to keep it from popping off, but okay, go ahead. Shot there. Okay, shoot it again. Yeah, it's coming off. Shot again. Okay, hold on. Yeah, it's coming. The thing is disengaged from the, that's all right. But you can kind of see what we're trying to do. I'll just show you, just keep going. And what happens is the cement comes out and it goes right into it. And what's nice is that, again, the longer you wait for the cement to mix, you can kind of see, this is what it feels like. So the longer the cement sits, the more viscous it is, and the less likely it is for it to leak out. So if you're concerned for, if you're posterior, if you don't have a good vertebral body, then I would suggest you wait a little bit longer, and all the manufacturers, it's the same. The longer you wait, the more viscous it is, the less likely there is for leakage. So we're going to go ahead and take our cannulas out, and then let's get one final AP and lateral, and then we're done. So you can see, again, we did S1, L5, and we skipped one level, and then at the very end, we did L2. Great. So can you guys see that? We actually skipped, sorry, L3. Maybe just go straight up and down. And that last level there is the sacrum. And you can see some of the cement had gotten into the, and it went lateral, which again happens in real life. And you can't even see the spine jacks in there. So, great. Thanks, everyone. Appreciate Sven and Ravi and Tyler. And you can see on the AP there, just there's a little bit of lateral leakage, but nothing posterior. And we got a little bit of stuff going in the disc space. But you can see how nicely, how much end plate coverage and how much of the vertebral body you can cover. So, and then you can see on here, look, they're just little stab incisions. And again, because this is a cadaver, normally in a live patient, you won't even be able to see that. So, great. Thanks, guys. Any questions at all?
Thanks, Rod. I really like that demonstration. It makes me feel like I just want to go ahead and get a kyphoplasty myself.